Sabrina Sanchez, and this is my Student Congress Bill 1. Today I'll be discussing whether we should vote yes or no on universal healthcare. Alright, I'll start with discussing on wait times. Example of the lengthy wait times associated with the universal healthcare would be in 2017. Canadians were on the wait list for an estimated, I can't say the number, so I'll put it right here. Not so much. Procedures, and the median wait time for arthroplastic surgery was between 20 to 32 weeks. No, 32 weeks, 52 weeks. Similarly, an average wait time for elective hospital-based care in the United Kingdom is 46 days. 46 days, while some patients wait over a year, and the wait times would increase in the United States, would at least in short term, increased wait times in the United States would likely occur, at least in short term, as a result for steep rising numbers in primary and emergency care visits, as well as generally wastefulness, disorganized, and ineffective care given to the patients that come in and out. As said before, the wait times would increase, and with the increasing, that there would also be an increase in demand, creates a massive burden on how the patients will be organized in a manner that allows those who are most critical needs, to the people who just like have cut or need just a simple doctor's appointment. Those wait times would be extended, and the burden on our healthcare, the way our healthcare is today, would be great. Especially if you look how the COVID-19 affected on our healthcare, it's totally bad. And imagine that on a global scale, where we had a countrywide scale, on how if we had universal healthcare, on how everyone would be jumbling up to the hospitals and doctor's office, overrunning the system. I have an example of our wait time, because a few years ago my father, he had a heart surgery, a double bypass, and we found that like right away, and 2 weeks after, 2 weeks after, he was able to enter into surgery, and there was barely any wait time. 2 weeks, and that's a major surgery, and I know that it takes a long time. I remember, and how the doctors were all nice and everything, and without that major surgery, because this is an open heart surgery, without that surgery, he would not be here today. If he waited a little longer, he would not be here today. If they extended that wait time to, let's say, 5 weeks or a month, he would not be here today. That's why we need the private sector, private insurance and all this stuff, and not universal healthcare. Because universal, I said before, would extend that wait time to like a month or more, and you'd be dead. Instead, we got 2 weeks since we didn't have it. So that's one good example on how we should not have universal healthcare. Little known side to the single payer healthcare system is that there are budget caps. In Canada, where the system has been around for a few years, and they already get used to it and how it's done like that, there's usually a set amount of budget to how much the public pays for access for medical procedures. When that cap is met, there's no room for no more. Basically, this leaves patients needing surgeries and other treatments wait until the next facility budget is released. In turn, overall, the quality will become diminished, and those who desperately are in need of services will not get those needs. And I said before, they'll most likely die and kick the bucket, Another disadvantage of having universal healthcare would be that healthy people would pay for other people's medical care. Like chronic diseases make up 97%, 90% of healthy care costs. The sickest make up around 55% of the population, which creates a total of 50% of healthcare costs. However, it is true even outside the universal healthcare system, as a spending on chronic diseases will rise and the cost of private health insurers plans will as well. There's still some benefits to private health insurance, since they give you certain things that the universal or the government one system care would not be able to give you, like specific doctors. You won't be able to choose what doctor. You'll be able to have the doctor that you are set on, and that doctor probably doesn't have that much time to spend on just your one case. But with the private health, the help of the private sectors and healthcare systems, you're able to choose which doctor you want. You're able to schedule which doctor for which thing you need, and you're able to have referrals faster than you would have with regular care. We want the private. People have less financial incentive to stay healthy. Without any copay, people might oversee emergency rooms or doctors, basically saying that people, if it's free, people are going to abuse the system. People are going to go in for every little thing and waste time and money and resources that they could be used for other stuff, other medical emergencies. Someone's child getting sick or having an allergic reaction to someone having not be able to breathe or having brain damage. Those big emergencies could be wasted on something small, like coming for a cough that's just nothing, just a cold, or coming in drunk or high, stuff like that. And it will occupy all the rooms and take all the doctors away. But with private healthcare, you're able to stay healthy. You're forced, and you have not forced, you have an incentive to stay healthy, or else you have to pay. So people are most likely rather stay healthy than do all the work and pay money to go to the emergency room. Another downside to universal healthcare would be where the money would come from. People mostly say, oh, it's going to come from the top 1%ers. No, it's not. Because most of the time, when the government needs money, they go after the middle class. And the middle class takes most of the burden. And those people in the middle class can barely hold afloat. But if they have to pay more money to the government instead of the money they could use for a rainy day or another car payment or some trips for the family, some more Christmas presents under the tree, something else they can save that money in to put it in a trash fund or anything, that money be sent to the government to pay for other people's health care. Not just their own, other people's, but with the private sector, there's a set amount price they pay every year instead of the one that increases every year because of taxes. Another downside is that it would limit new technologies that can develop, because there is such a drive in keeping costs down. The innovation would fall behind the universal system healthcare to compare to the free market system. That is because there's a less funding available for new research and new technology within certain fields. Over time, the lack of funding for research would go down, and development could also actually cost more lives than are saved by the extensive research and access to that certain technologies that could have been developed but didn't, because the government didn't want to pay enough money for it and decided to go cheap and just go like, it's okay, they can handle it. No. But with the private sector, they're able to fund those projects, run those research, to go more in depth into what they are and put the money out there because they want to help people. Overall, I like to ask some questions for people who are pro healthcare. Is that what will happen to the money that used for research? What they would use for researchers to research certain diseases? Would the government be able to put that money out? Would they be able to sacrifice some stuff? Would we have to pay for those stuff? Or where will the money go? Where will the money come from, actually? Another question would be that, are we willing to sacrifice resources that we could have gotten with the private instead of the universal? Like I said before, you have to wait a long time. You're able to see certain people because you don't have that option. Are you able to sacrifice that instead of getting like a young, not so good doctor kind of ish, instead of you can get an expert? Would you be willing to sacrifice that? Thank you for listening to me so much. Hopefully this convinces you to say no. But if you say yes, it's okay. Thank you for watching. Bye.